Painful lumbar radiculopathy is a type of neuropathic pain, often linked to nerve root compression or inflammation caused by herniated disc. Traditionally, doctors believed that the size of the herniation or the degree of inflammation directly determined how much pain a patient would feel. However, the reality is more complex. Recent research, including a study of patients scheduled for spine surgery, suggests that the mechanisms behind this pain are not solely physical. Patients in the study underwent a variety of tests, including MRI scans, blood work for inflammatory markers, and psychological assessments. The goal was to uncover what truly drives pain intensity in lumbar radiculopathy, and whether factors beyond what we see on scans or in lab results might play a bigger role. This study, 53 patients with confirmed painful lumbar radiculopathy were evaluated before surgery. Researchers measured pain intensity using standardized scales and questionnaires, and performed sensory testing to assess how patients responded to different stimuli. MRI scans were used to analyze the size and location of the herniated discs, while blood and disc samples were tested for inflammatory markers and infection. Importantly, the study also included psychological assessments, such as the pain catastrophizing scale and anxiety inventories, to gauge how patients thought about and emotionally responded to their pain. This comprehensive approach aimed to connect the dots between physical findings, biological markers, and the psychological state of each patient, offering a holistic view of what might influence pain. Surprisingly, the study found that neither the size of the herniated disc nor the levels of inflammatory markers in blood or disc tissue correlated with how much pain patients reported. Instead, pain intensity was more closely linked to psychological factors, especially pain catastrophizing, which refers to a tendency to focus on and exaggerate pain and to feel helpless about it. Another important factor was conditioned pain modulation, CPM, a measure of the body's ability to regulate pain signals. Patients with lower CPM efficiency and higher catastrophizing scores reported more intense pain. Gender also played a role, with women tending to report higher pain levels. These findings suggest that the subjective experience of pain in lumbar radiculopathy is shaped more by how the brain processes and interprets pain, rather than by objective measures like inflammation or disc size. Results of this study challenge the traditional focus on imaging and inflammation in managing lumbar radiculopathy pain. Instead, they highlight the importance of psychological assessment and interventions, as well as the need to consider individual differences in pain modulation. For patients and clinicians, this means that addressing how a person thinks about and copes with pain may be just as important, if not more so, than treating what shows up on an MRI. Larger studies are needed to confirm these findings, but the message is clear. Effective pain management should look beyond the physical and embrace a more holistic approach.